Hello and welcome to this episode of A Mind of Her Own. My guest today is Dr. Cory Newman. He's a professor of psychology in psychiatry and director of the Center for Cognitive Therapy at the University of Pennsylvania, also honorary faculty at the Beck Institute for Cognitive Behavioral Therapy. Dr. Newman did his postdoctoral training under the mentorship of Dr. Aaron Beck, who is really a founding father of CBT, and Cory is a founding fellow of the Academy of Cognitive Therapy. Dr. Newman is an international lecturer, having presented approximately 300 cognitive behavioral therapy workshops and seminars, and has published over 100 articles and chapters on cognitive behavioral therapy, and has authored or co-authored 6 books, which is really incredible. Now that I've written just one, I know how much goes into that. So, Dr. Newman, thank you so much for joining me today.
Jennifer, thank you so much for the invitation. I'm very happy to be here. I've heard so many of your podcasts, and now I'm taking part, so I'm happy.
Awesome. Do you mind if I call you Cory? Is that okay?
That's
Since
fine. First name
we go
basis.
way
Yeah,
back.
we go way
Okay.
back.
So I love you'd reached out to me about an idea, a discussion, some topic you really enjoy talking about, which is how do we kind of bring CBT concepts into our everyday communication in our lives. And I love that idea because I think the more practical we can make this, the more helpful it is for the most people. And I'm wondering if we could just start with sort of your definition of cognitive behavioral therapy or
Sure
CBT.
thing.
Like, how would you describe that to
I
someone?
admit it's very difficult to put into a soundbite because CBT is such a broad net.
Yeah.
But I'll say this. Based on 3 basic foundational principles, one is, of course, like any good therapy, based on a solid, supportive, validating therapeutic alliance. Number 2, a very good understanding of the patient's life, their lived experience, how they've come to see themselves the way they do, their key life challenges, problems that they have, how they adapt to their environment. This has to do with cultural issues, discrimination issues. So there's sociological factors too. So their lived experience and how they see themselves in their world. And then the third part is coping skills. It's a very psychoeducational therapy, teaching people how to use good reasoning skills to maintain constructive thought process, not the kinds of thought process that promotes hopelessness or helplessness, but a thought process that creates agency and a sense of the ability to do problem solving and to grow as a person. Coping skills for the everyday little stressors of life, but also coping skills for the big issues as well. Um, and coping skills that help people feel a sense of increasing mastery over time. Obviously, we can't control life entirely, but we can have better and better self control and self mastery. So again, combination of positive, supportive therapy alliance with a very good understanding of the patient's life, their history, how they see themselves in the world, and third, lots of good coping skills.
And I think when people talk about CBT or think about it, myself included at times, we focus on the C part, the cognitive, the thoughts. How do we shift
Correct.
our thoughts? And I think the other piece, that behavioral piece, is so important because it's also when we go out into the world, how are we showing up? What are the different things that we're doing? And in part, how are we interacting with others, which is what communication really is. So, how do you think about the idea of kind of shifting CBT into our daily
Sure.
lives?
So, a couple things. First of all, I should add that communication is not only external, it's also how we communicate with ourselves.
Mm.
We're always having inner dialogue, inner chatter. So, yes, I'm talking today a lot about improving communication interpersonally, but I think it's also the case that CBT is very good at helping people talk to themselves in a more compassionate way, a more constructive way, a more hopeful way in the inner chatter that goes on. I think also with communication there is expressive communication and there's receptive communication. So expressive communication is how do we speak to other people? But receptive communication is how do we understand other people? How well are we listening? How well are we tuning in? Are we letting people finish their comment before we interrupt? So that part is also very important skill, the listening skill in the CBT part. And because CBT is known as being very much about an individual therapy, though certainly you can do couples therapy in CBT, you can do group therapy in CBT, but it's considered a lot, one-on-one individual therapy. But absolutely, the person's interpersonal life, the person who's seeking therapy, is talking about the people in their lives and their interactions, whether it's at work or personal life or friends, whatever. And invariably, cognitive behavioral therapy focuses on emotions and people, emotions and relationships. Yes, we call it cognitive behavioral because looking at people's thought process and what they do, their behavioral habits, are very fruitful areas to get into the system and help them make changes. But absolutely, CBT focuses on people's emotional quality of life and their interpersonal relationships. So anything that they learn in therapy individually about how to speak to themselves more compassionately and more constructively and with better hopefulness can be applied in their communication externally to other people.
So, how do you see that as different? I'm a big proponent of interpersonal therapy, which kind of
Right.
is working in the same area. How would you sort of compare those two if someone might be seeking to do some of this work?
I think it's a matter of emphasis. I think there's a lot of overlap. If you saw a Venn diagram of CBT and IPT, I think there's a lot of overlap. Certainly, IPT will put more relative emphasis on relational issues, and CBT will put more relative emphasis on how do you talk to yourself? How do you organize your behavioral habits? What kinds of coping skills do you use? But certainly, there is a lot of overlap in terms of the importance of relationships in life, whether you're doing CBT or interpersonal psychotherapy.
Yeah, no, I agree with that, and I love that frame. Really, you can get great work and great support with a therapist that you really connect with and trust. And I think that's a big part of what you're describing in this communication is how do we make it empathic and validating and collaborative. So let's dive into that. Like, if we
Sure,
want to kind of go through, what are the pieces we want to bring to these areas
sure.
of communication?
So let's start with the communication of a therapist, and then see how much of that could be applied to just everyday life. It starts with intent. What is the intent of the communication? So with therapy, therapists, by and large, I hope, I think, have the intention of boosting the patient's morale, giving them a sense of hope and support, teaching them something useful, giving them useful information, communicating understanding. But it starts with that intent. My intention is to help. My intention is not to talk over you. It's not to subjugate you. It's not to demean you. It's to assist you, boost your morale, and give you something useful to to learn. In everyday life, we can adopt that similar mentality without sounding like you're doing therapy speak per se. You can still have communicate a positive intention each time you talk that I'm with you, I'm on your side, I'm trying to help you out. Or maybe if you're not on their side exactly, I want to have a respectful conversation with you. I want this to be constructive. I want us to come out of this discussion in a better state than when we started, rather than in a more fractured state than when we started it. Um, I want to say something that communicates respect for you, even if I disagree with you. I want to communicate something that makes an attempt, a good faith effort at finding common ground, even if we disagree. I want to be able to provide something useful to you to consider. I'm not trying to talk over you, say that you're wrong, I'm right, but rather here's something to consider. This is a position I have. I hope you'll hear this. I hope you'll find this useful. And the usefulness of the information is very important. I can extrapolate just a little bit, if I may, that think about giving information or the purpose of communication, to boost morale, to connect with people, to give useful information. We ideally want what we say to have validity and utility, both. Validity is the truthful part, like what I said was the truth. But it's interesting. Sometimes the truth alone isn't enough because truth can be harsh. People sometimes will brag and say, well, I'm brutally honest. I'm a brutally honest kind of person.
Right.
Well, honesty doesn't have to be brutal. Honesty can be compassionate. Honesty can be respectful. And I would argue it ought to be. So saying what I'm giving you valid information is the start of the process, not the complete process. It also has to have utility. It has to be a useful thing to say. I might have something truthful to say, but you know what? That's going to hurt the person. I'm going to wait till a better time and say it more tactfully. I'll give you a kind of a silly little everyday example from my personal life about validity and utility in communication. I have a memory of many, many years ago when my daughter was a pre-adolescent. and I'm driving her to her pediatric dental appointment. And I have this strong urge as a parent to double check on the child. And did you brush your teeth before we left home? But I thought to myself, well, that's a valid question to ask a child that you're bringing to a dentist. Did you brush your teeth? But it has no utility because if I ask and she says, well, yes, I brushed my teeth, Dad, now she's ticked off that I didn't trust her. If she says no, now I'm frustrated because it's too late. It serves no useful purpose. It would have been useful if I'd asked her before leaving home, did you brush your teeth? But now it's not, it has no utility. So you know what? I thought, mom's the word. Deal with your uncertainty, Cory. Suck it up. She'll be fine. And the dentist, I'm sure, deals with people who don't brush before their appointments anyway. No big deal. Simple example of making sure that your comment has validity and utility before you say it. And
That's
back to the
interesting.
brutal, really, and back to
Yeah.
the brutal honesty thing real quickly. Endeavor to make your direct and honest comments, even the difficult things, as compassionate as you can.
It makes me think about political conversations, whether
Oh
it's
my
with
goodness.
strangers or with family members, sort of the maybe very dramatic example of this. But as you're saying, how do we, because in a therapeutic environment,
Yeah.
hopefully the patient sees that we are respectful of them and we've built this relationship, we have this therapeutic alliance, as we call it. How do we begin? I mean, I don't think we're solving that huge problem
Yeah.
here today, but how do we begin to express respect, express respect
Yeah.
and validation, even though we may disagree very
Sure.
significantly?
With hot button topics like the state of the world, which is has such gravity and stirs up such deep emotions. I don't want to trivialize how difficult that is to deal with the issues and to communicate with someone who sees things differently. So what I'll do is I'll take a segment of that and talk about when you disagree at a political level with someone that you care about. Then you're in a legitimate position to say something along the lines of, I feel very torn because I value our relationship. We go back a long way, but I see things so differently than you see them. And it's hard for me to reconcile that. And I hope we can talk about it, but sometimes we just have to maybe agree to disagree and not bring this up. But I'm really torn about it because I value you. And when you know someone for a long time, you care about them, you're in a position to say there's that split, there's that dichotomy. If you don't know someone well, they're not part of your life, there you're not going to have that latitude of saying, yes, I'm torn because I care about you. There you have to sort of, again, ask yourself, is there utility in getting into this with them? You may have many valid things to say, but if all it's going to do is cause a big conflagration, that might not be useful.
Yeah, it's sometimes hard to decide, right, whether or not it's
Right,
worth it, so to speak, if you don't believe you're going to change someone's mind, but you want to share what you
right.
believe and try and speak up.
And good point, Jennifer, about changing someone's mind. And this goes way beyond political things. This goes into, again, more everyday mundane kinds of things.
Yeah.
In terms of belief systems, here's the cognitive part. A lot of people believe that when you have a disagreement with someone, it's very, very important to convince the other person. And actually, although that might be a nice outcome if you can make your point and they're convinced, oh, I see the light, you're right. Actually, the main thing is that you make your point. And sometimes it has to sit in the mind of the other person and it has to percolate. And it might take some time before it makes an impact. It might not make an impact, but you don't have to make the person change their mind right now. They don't have to get it right now. If you make your point respectfully, that's already a triumph. And in fact, when I talk to therapists in training, they sometimes really are very zealous and they want to help people change their cognitions and go from thinking I'm a failure to no, I'm human, I make mistakes, I'm a good person, and they have the mindset of nobody leaves my office until their cognitions are changed. I'm saying they're allowed, your patients are allowed to leave your office without their cognitions being changed. It's a process and it takes time. You are trying to create a dialogue over time. It's back and forth. You look for evidence, you look for real life examples. And over time, your patients may come around and feel better and see things differently. But you don't have to do it on demand.
And I loved how you differentiated, I mean, that there is this receptive communication. And so it makes me think certainly I've learned a lot from my patients and I'm trying to understand their experience. But even when you're out in your relationships in your life, what are some things to be thinking about? Because they might be trying to change my mind, right? And I might be very sure that there is nothing they
Yeah,
could say that would change my mind. But like,
right.
how could we actually shift our listening skills to be a bit
Sure.
more open to these
Very good
conversations?
question. So one important goal is to let the other person know that you are in fact listening, that you're not tuning them out with your next rebuttal. And that's where something, a good communication skill of being able to summarize really comes in handy, where you can say to the person, okay, if I hear you correctly, what you're saying is X, Y, and Z. Okay, am I on target with that? All right, here's why I see things differently. But if you start with, if I hear you correctly, are you saying X, Y, and Z? You're showing that you're listening. You're giving the respect of tuning in. That's a good start right there. And maybe you might say, do I hear you correctly? And they say, no, that's not it. Oh, I'm sorry. I'm glad I asked. What am I missing here? I want to get this. I want to hear you.
Mm-hmm. Yeah, I really like that. And being able to, I mean, we certainly do that in therapy, right? We sort of reflect back to
Right.
the patient, this is what I'm hearing from you. Do I have this correct? And so, again, that parallels beautifully.
And sometimes I will point out maybe a mismatch between intent and impact. The intent is what the person speaking is trying to convey, but the impact might be different. And if there's an incongruity there, there's room for negotiation. Because sometimes people do intend to hurt people with their comments. They intend to demean, they intend to criticize, manipulate, deceive, misinform. That's malevolent communication. But sometimes the person doesn't intend to cause harm, but the impact is harmful. And so sometimes it's important to say, I don't think you're trying to put me down right now, but the message you're sending sounds like a put down. And I'm not saying that's what you're trying to do, but hear me out. Here's why it sounds like a put down. So you're acknowledging, I don't think you're deliberately being mean, but you should know that it could be construed that way.
Yeah. You hear a lot in some of the kind of wellness spaces and, clips online, this idea of feeling your feelings, which
Mm-hmm.
sounds a little trite, right? But the question I come up with a lot and working with patients and in my own life, and as a parent, certainly,
Yeah.
is when I see someone, maybe someone's feeling anxious, being able to truly validate without saying that that's true, what they're worried about is true, or jumping right to, let's see how we can fix it, or let me give some
Sure,
advice.
sure. Yes.
How,
So
how do you
here's a
describe
good
that?
mixture of those two things.
Mm-hmm.
And again, this works in therapy and it can work in everyday life. First, seek to understand. Communicate that you're trying to understand why they have reached this place of great turmoil, anxiety, despair. Your first instinct might be, oh, you don't have to give up. Oh, you don't have to be catastrophizing and worry so much. But first, seek to understand. It's like, the way you're talking about this situation, if I were thinking that way, I would be kind of a nervous wreck right now. If I were thinking the way I hear you talking right now, I would be down on myself. That's really harsh stuff that you're saying to yourself. So you start with the validation and then say, but are you being fair to yourself? Is that the only way to look at it? I mean, that's one way to look at it. You're not making that up. You feel that way. But that seems to me like that's one way to look at it. And there might be other ways to look at it that might not be as upsetting. Can we entertain those?
Yeah. It certainly parallels when my book about guilt, the guilt equation I came up with is just that guilt is our expectations in a particular situation, whether or not they're
Right.
fair, we can talk about, minus our perceived reality. So, what do we perceive was actually happening in that situation? And I think where some of those catastrophic thoughts can come about, right? This is actually something
Right.
really, really bad. And so, I think that really ties in to what you're saying here is that when there's this disconnect, how can we be compassionate with ourselves for having the feeling, but also begin to kind of push back? How do we help? I'm thinking when we're talking to ourselves, when we're talking to
Sure.
some others, we want to understand, we're trying to validate the feeling and empathize. It sounds like that I would be
Correct.
having the same situation. And then what can we do next?
Yeah. So the next part is where you get into the problem solving part. First validating, hey, look, I see why you're upset or I see why I'm upset. And it's okay to spend some time venting. It's okay to spend some time emoting.
Mm-hmm.
But let's balance that with also thinking about having some agency here, about having a sense of efficacy. What can be done about this? Maybe the whole thing can't be solved, but there's probably something constructive that we can think and do to get things trending in a better direction. And that's worth a lot because if we're going from spiraling downward, and lots of people say, yeah, I get into a downward spiral and I worry.
Mm-hmm.
Let's reverse the downward spiral and begin to trend in an upward direction. We may not get to a great place right away, but we've reversed field. So what's one positive thing you can do? And speaking of communication, sometimes I'll have a patient who, one of their faulty communications is not communicating. They don't respond to messages. They don't tell people where they are. They don't, if they're students, they don't get their assignments done. They don't respond to their professor's outreach. And we try to help them to be willing to communicate, to like actually, make that extra effort and not make the mistake of stonewalling or giving the impression that they don't care. And working on being able to do some outreach and say, I'm here, I'm acknowledging your message, I'm working on this. And if you're beginning a process of repairing the problem, if you communicate, I will tell patients a lot when they say, I don't know what to do, I don't know what to do. So you know what? Usually the first step is some sort of communicating. With whom can you communicate to begin a process of apologizing, saying that you're working on the issue, saying that you're going to be there soon, saying that what they thought mattered to you. Some sort of communication is very typically the first constructive step toward problem solving.
And I think in this increasingly sort of siloed experience of everybody online, for example, sometimes it's hard to even get somebody to the point where they're willing to consider communicating. There's either,
Yeah.
that's really too stressful, or I'm very shy, or I think they would just be dismissive anyway. Like, I'm wondering when you have someone that's not even at a place where they're pre contemplating the idea of
Yeah.
communication, how can you help them in that?
Well, from the therapy standpoint, therapy itself is a testing ground for building communication skills. And so I try to model how it's possible to make some small gestures toward other people to at least acknowledge, to at least say, I'm here and I'm listening. It's tough to build good communication skills in general. It's even tougher if you have a lot of self insecurities and anxiety. And I do appreciate that. And that's part of seeking to understand. But the therapy is a testing ground for developing those skills. And in everyday life, pardon me, you can't make someone communicate with you, but you can communicate to that person who's being silent. Whatever you say, I'll be just happy to hear from you. I'm hoping that you're okay. You don't have to agree with me, but just let me know that you're doing okay. Or we don't have to have a long discussion about this. I'm just outreaching to say I hope you're okay. But I mean, I'm being redundant, but the point is that there are little things that you can say, little things I call polite minimalism that don't take that much effort, but it sends a meta message of I'm here and I care. And sometimes that's all you need, or sometimes it's a foundation for a more in depth discussion later. But I admit, for some people, communicating stirs up a lot of anxiety, and we have to respect that while still making requests of them to try to extend themselves a little bit to communicate back. And using that term, I would appreciate if you could extend yourself a bit. I know this is hard, but I would appreciate hearing from you. And that's a request. And another communication tip while I'm thinking of it is for everyday life is try to turn complaints into requests. Almost any complaint can be converted into a request, which is much easier to hear. So I could complain and say, you never reply to my voicemail messages. You disappear on me. You ghost me. I can't stand when you do that. That's the complaint. I could turn that into a request. I really would appreciate if you could get back to me just to let me know that you're okay. It really is difficult for me when I don't hear from you. I respect your privacy, but can we talk just for a minute? Make a request rather than a complaint.
And I'm wondering, I mean, when I was studying guilt, there was a lot of talk of, adaptive guilt is when it's specific, there's a particular situation, we want to try and make a repair. But one type of maladaptive guilt is when it's manipulative. And I'm wondering
Correct.
how we get into maybe being more assertive with how we're asking for and making a
Sure.
request without it shifting into the guilt that I think does then push someone away.
That's a tough one. And that gets into first the self-respect of saying, look, I have my own boundaries. I respect my own boundaries. I'm going to communicate that respect, but I'm going to communicate it respectfully, not by chastising the person, but by explaining where I am and saying to them, here's my intent. My intent is not to make you feel bad. My intent is not to make you feel guilty. My intent is not to get you angry. If you feel that way, I truly apologize. My intent is to let you know where I stand in the hope that you will meet me halfway at least.
Mm-hmm.
So communicate intent, which is not to harm the person, but to show self respect.
I can think of situations where I have a friend who lives far away and I may wait to call him because I want to make sure I have plenty of time to really sit down and talk through and
Right.
communicate and express my care for him. I don't want a quick call where I'm like, I have to go, I'm sorry. But then that means lots of time can go between our
Sure, sure.
communication. And I'm wondering how you might counsel either us out in our lives or
Yeah,
even patients
yeah,
about the modality of connection,
right.
text, emails, phone, and just this idea of those little
Sure,
moments.
sure. Good question. Very rich. So, first, I'll start with one of the CBT concepts of watch out for all or none thinking. Watch out for seeing things in black or white, up or down, all or none, zero, one. There's lots of space in the middle. So you've got more choices than either go long periods of time with no communication or have this elusive 90-minute block in which to have a video phone chat. And you can use things like text messaging for these little random acts of kindness where you just send a brief message saying, it's been a long time, but I was thinking about you today because I saw this person on the Olympics who reminded me of you. Have a good day. I'll give you a call first chance I get. Might be a while. I'm busy, exclamation point, laugh out loud. See you soon. And that might take a minute. But that makes the point I'm thinking about you. And that's the middle ground. So I like this. I like the random act of kindness thing through text messaging. Text messaging, unfortunately, has been used for long screeds, which is really problematic because text messaging is intrusive. A person receiving it isn't saying, I'm ready for a sit down chat. They're not saying, I'm going to check my email because I've got time to check my email. They're just getting pinged. When a person gets pinged, ideally it should be a brief, quick, oh, did you say we're meeting at 5:30 or 6:30? Or what was the kind of cornflakes that you wanted again? Like that's the kind of pinging that you want, not like this humongous thing about why you were what you said was upsetting. That requires something with more cues. In person would be ideal, but a video call would be great. A phone call would be great because you hear tone of voice. Tone of voice is lost in text messaging. I've seen so many examples of people getting into real conflict because of the tone. Sometimes, for example, nowadays one of the benefits of texting is when people come to my office and they say, I had this big conflict with my girlfriend, blah, blah, blah. And I'll say, do you have the text thread of that? Oh, yeah. Could you recite that to me? And I can actually hear the data of what he said, what she said, what he said, what she said, and what might be misinterpreted and give some feedback. So one time, this is a simple one word thing made a big problem. It was a back and forth between my patient and his girlfriend about what they should do that evening. And my patient texted, what he meant to text was, I don't mind. Like she had different points of view about what to do. He meant to say, I don't mind. But what he wrote was, I don't care. Like, I don't care. Like, whatever you want. But he just put, I don't care. And she heard it as, I don't care. Like, I don't care about you. And it became a whole big argument, which never would have happened if she'd heard him on a voicemail or in real time saying, I don't care, whatever you want. Tone of voice matters. Or I'll have the person read the text messaging to me and they'll affect a tone. And I'll say, how do you know that was the tone? What do you mean? Well, it was just words, but you affected a tone with that. How do you know that was her tone? So, for important things, for emotional things, at the very least, try to use something that is not intrusive. So, an email is non intrusive because a person typically will check their email when they want to check their email. Don't use texting for that. And also, then there's also the phenomenon, I have to laugh about this, of TWI, texting while intoxicated. Watch out for that. That can cause problems too. Try not to text while you're a little bit inebriated. Not a good time for doing that. That's a side issue. But back to, the means by which to communicate. The more emotional and the more complicated the topic, the more cues are needed. Vocal cues, body language cues. Try not to use texting for that if possible. I know it's a generational thing. I'm an old guy. I'm old school, but I think anybody can keep these principles in mind.
I think that's so important too in communicating online as well, that there is very little room there for nuance or to gather the tone. And maybe it's words are in all caps or there are a lot of exclamation points to highlight some exclamation, but it really is hard to know. And I think when you're trying to interpret someone's intentions there, you can really get into some
Right.
trouble.
Right.
Yeah.
Sometimes, if you really have something important to get into, it's okay to use texting just to say, hey, are you free for a call? There's something I'd like to talk to you about. Or you receive a text message that is very emotive. But rather than texting back and with your own emotions, you say, I think this requires a phone call. Are you free?
Yeah, no, I like that. I've certainly done that at times where it's like,
Yeah,
and plus I don't want to type that much because I really want to be able
that's
to
right.
communicate and hear how you
Sure.
are responding to it too, right?
Right.
How are
Right.
you
Yeah.
interpreting this? Make sure that I'm coming clear with
Yeah. When you're
communication.
talking by phone or in person, there's a natural cadence. There's a give and take. If there's a long silence, you can see, is the person pondering? Are they thinking? Are they tuning you out? If there's long gaps in texting, you don't know what's going on. You know,
Mm-hmm.
did their 4-year-old just fall down and they had to attend to him and they can't deal with the text? Or have they just now ghosted you? You don't know. When you're in person or on the phone, you've got more cues of that sort.
Mm-hmm. Well, let's get into some of the more negative
Sure.
communication,
You bet.
maybe things that you find people are doing
Sure.
or are talking to you about.
Right. Well, I'll start anywhere. Um, there is an unfortunate phenomenon of people in a conflict trying to win the argument rather than trying to resolve the matter. And, there's nothing inherently wrong with trying to win an argument, except when you're arguing with someone who matters to you, someone important in your life. And there's a danger of fracturing that relationship. An example, a painfully good example of this, the movie Marriage Story. There's a scene in particular with Scarlett Johansson and Adam Driver, and they're going through a divorce, or they've been divorced already, and they're having this argument where they're trying to out hurt each other. They're going up the ladder of, she says this that's hurtful, and he goes one step further saying a hurtful thing, and then she eclipses that with a hurtful thing, and they go further and further into, can I hurt you more? Can you top this with hurt? It's a devastating scene, and they're both destroyed by that argument, and that happens a lot. Or related to that is the idea that if I'm not being heard, I'm going to escalate my insults or my volume. And that's like all damage and no benefit. That's where, even if you're saying things that are valid, it's got validity, you might have a good position to stand on, and you're really angry, but now it's lost all utility because the other person isn't hearing your point. They're just hearing that you're being insulting and abusive. So it's very, very important in those moments to have that presence of mind of thinking, okay, this conversation is going in the wrong direction. We have to take a breather. We have to take a little break right now. The caveat is that when you say let's take a break, it's got to be a sincere break and not just avoiding the whole topic forever. You can't just stonewall the person. There has to be a certain degree of faith and trust that when you take a break, you will resume at some point and discuss the issue. Like I think about research done by John and Julie Gottman on their studies of couples. and they would have their couples come into their lab, and they would hook them up to all kinds of physio measures, their respiration rate, their heart rate, galvanic skin response, etc. And they could predict, and they would tell the couples, talk about an actual major thing in your life that's causing consternation. Typical things like money, sex, in-laws, child rearing, division of labor, all the big topics that cause couples to have conflict. And the researchers could predict which of these conversations was going to go downhill real fast based on the physiology of the people being measured. So the Gottmans, to cut to the chase, recommended that when you notice that your heart rate is really up because you're in fight or flight mode, you're fighting your this person right now, or you want to flee from them, take a break and resume the discussion no sooner than 20 minutes after your heart rate gets back to baseline. Get the heart rate back to baseline, wait 20 minutes, and then resume. I've actually used that with things like returning phone calls or emails. If I get a message that gets me angry, I think of the Gottman studies. I think, got to wait till 20 minutes after your heart rate's back to baseline before you respond to this. Otherwise, even if you try to be caring, the annoyance and frustration will leak out.
And it makes so much sense because you think about a toddler who's tantruming and you can't get through to that child in that moment. Or you think about a
No.
teenager who's having these huge emotions and trying to problem solve when they're in that place is clearly so difficult. But I do think we forget as adults that we have the same physiology and maybe a
Yeah,
matter of degree or certain context or topics, but we still very much go into that same, ancient fight or flight mechanism when we're
absolutely.
under
And
threat.
if you have good self-reflection skills, which is another skill we help people with in CBT, how to tune in and reflect and know what you're thinking and what you're feeling and let that guide you rather than just respond reflexively. Um, if you have good self-reflection, you can actually say to someone, I'm getting really ramped up right now. This is not a good situation. I need a breather. I need to take a walk. We'll resume. But you start by saying something about your own physiology. Like, I know right now I'm getting very, very upset. And my goal is not to my goal is not to argue with you. It really isn't. But I'm going there and I want to stop right now. I want to have a calm discussion, but I need a break. Like, spell out the intentionality, spell out the goodwill, even when you're angry. But that takes a lot of self reflection to do that. But like any skill, practice helps.
There's something that I've heard a lot about relationships and conflict, and I don't know who originally would have said it, but this idea of never go to sleep angry. And I think, thinking about my own experience in a relationship, there are some times where we get to the end of a long day and we are exhausted and just completely fried and irritable, and there is probably no way we are
Yeah,
going to resolve this. So I,
right,
I
correct.
think, I don't think that's great advice. I think sometimes we
Yeah,
do, sometimes we wake up the next morning and it was like, I'm so sorry. I don't know what, what
yeah,
that was about. What are your
right.
thoughts on that
Well,
recommendation?
I think it's well intended, that
Mm-hmm.
comment, because the message is try to resolve things with your partner rather than dwell on it and chew on it and harbor negative feelings. But you're right. The reality is that you can't always resolve things on demand. And in fact, sometimes it's harmful, especially in the scenario where one person is insisting that you stay up and solve this problem and have this discussion right now, and the other person it really needs to sleep. In that situation, I'll make the position statement: the person who needs to sleep has to be honored. Do not keep somebody awake with an argument. That's actually destructive. By the same token, the person who wants to resolve the argument has a right at some point to hash it out, just not right now when your partner's trying to sleep. So the meta message, which is don't harbor things, don't respond to your anger by the silent treatment. That's also very harmful. Try at some point to actually have a discussion about it. And I understand that the silent treatment might be at first because the person's so upset they can't bear to talk about it or they're not ready yet. But then there comes a point where being silent morphs from I'm not ready to I'm now using it as a weapon to make you feel bad. That's really harmful.
Yeah, I
Talking
wonder
things out
just,
is it? Yeah,
yeah, I mean, even just being able to say that, and like you said, to
yeah,
be self reflective enough to know that this is why I'm not talking. I mean, this will come up for me a lot. My husband will be like,
yeah,
You're a psychiatrist. You know what you're thinking and feeling right away. Like, why are you not talking to me? It's like, no, I have no idea. I am so frustrated right
Mhm.
now. And so
Yeah, yeah,
I think somehow being able to place a placeholder or something that indicates I want to talk this through, but right now I can't yet, I think
that's
can
right.
really go a long way for that.
That's right. That's right.
Yeah.
And for the person who is trying to gather themselves, really useful to have that point of view of at some point it will be useful to talk. My goal is not to freeze out the other person. That's not useful. It doesn't have utility. Even if I think my position is valid, we have to talk about this. But I also deserve, out of self-respect, I deserve a chance to cool off. And there's a middle ground
Mm-hmm.
between full bore argument right now, no holds barred right this second, or stonewalling interminably.
What about situations of attempting to communicate? I certainly see this intergenerationally, like when we have a parent or a grandparent talking to a child or vice versa, an adult child maybe, and it's just the same message over and over and over again, and the same conversation over and over again, and them not really responding. Maybe the patient is the adult child that I'm working
Yeah,
with,
right,
or a
right.
friend of mine. They're not really hearing their boundaries or their limits in that
Yeah,
communication. So the question
right.
is, how do you move forward in that?
Sure, that's another tough one because sometimes you do assert yourself appropriately. You do seek to understand the other person's position. You try to express the intent. I'm not trying to hurt you, but to tell you where I'm coming from. If
Mm-hmm.
you're lucky, the other person sees the light and says, I appreciate your saying that way. That's hard to hear, but the way you said it, I can understand. That's ideal. But sometimes the other person just doesn't get it and they will keep rehashing the same pressure points, like a full court press, for a lifetime. And that's where the person trying to set boundaries has to make a hard decision about has this passed a point where it's not useful, again, it doesn't have utility to try to convince this person or talk to this person. I need my space, I need my distance, or to make some kind of contingency and say, look, I would like to talk to you, but not under these conditions. If you can get to a point where you have some respect for what I said, let me know. We'll talk. But I think I've reached my limit. And even then, you can do it respectfully. It's hard when you're in fight or flight to say it with that kind of tonality and not increase the volume. But you can walk away knowing you've done that respectfully. And if the other person's trying to guilt trip you, saying, you're so ungrateful, you never listen, you can look in the mirror and say, no, actually, that's their position, which makes me very, very sad that that's the way this person in my life thinks about me. But I know I extended myself to be caring and understanding and respectful, but also self respecting. I did my part, but communication is a two-way street. They have to do their part too, and they're not. And that's a sad reality, but I feel good about how I handled it.
So in my book, it's focused on women and women's guilt, and
Right.
obviously everyone experiences some guilt, but this sort of broad sense of I'm just not getting things right, I'm not doing it right. And one of the big areas I really wanted to talk about was the idea of disappointing someone.
Yeah.
And I think what can happen to a lot of women I've worked with is there's this worry I don't want to disappoint them. So I make a different choice. Maybe guilt drives me to disappoint myself, or maybe it drives me to just not even bring up the topic ever, just totally avoid it because I don't want to disappoint them. But then the situation arises where I haven't RSVP'd for an event
Yeah.
the
Yeah.
day it occurs, because I don't want to disappoint. And so I'm wondering how you
Right.
might
All
talk
right.
about that.
So this may not answer globally, but I can answer specifically about things like the RSCP example, where let's say you get an invitation and for whatever reason, either you can't go or you're uncomfortable because someone's going to be there that you don't like, or it conflicts with a thing you really want to do for yourself, and you don't want to disappoint the person. It's worse to disappoint them through silence. And the reason is that when you don't communicate what you're really feeling and explain your situation, it leaves a vacuum. Nature abhors a vacuum. What is going to get sucked into the vacuum? The other person's assumptions that you have no control over. So if I don't respond, if I don't RSVP, the other person will insert into the vacuum their assumptions. Cory doesn't care. Cory must be ill. I'm worried about him. Cory has just checked out and he's no longer part of our friend group. And usually the assumption that got sucked into the vacuum is worse than the reality if I had just been able to say, hey, you know what? I've got a conflict. I feel really badly. I want to come to your event, but I have this other invitation that may seem kind of trivial, but I've been kind of waiting for it for a long time. So I'm hoping that our friendship is strong enough that I can bail out this one time for you and we'll still be okay. But I can get to have this unique experience in the other place. And I feel really bad about it, but that's the truth. That's where I am. That's hard to say. And there's no guarantee the person will accept it properly. But pretty much that's better than just nothingness and leaving the vacuum.
I agree. I think that the other person can really use personalization, right? This distortion of I've done something wrong or I'm at fault
Right.
if we
That's
don't
right.
give
Oh,
them
that's
some
that's a very good
explanation.
point. Part of their assumption could be, what did I do to offend Cory? Have I made Cory feel alienated? That wasn't it at all.
Hmm.
So just remember that the assumptions usually are worse than the reality. So speak the reality.
I have to bring up, with communication, I interviewed a woman who created a documentary about women surgeons called
Yes.
1001 Cuts. And she talked in that documentary quite a bit about communication and the differences in how a female surgeon was sort of expected to communicate compared to a male.
Right.
And I don't think this is specific to surgery. I think
Right.
women, when you think about being assertive, you think about asking for what you want, the idea of saying,
Right.
like, would you mind handing me that scalpel, please, if you have a minute, as opposed to scalpel, you know? And I'm wondering,
I say, could I trouble you for a scalpel?
yes, please, if you just don't mind in this moment, I'm so sorry to trouble you.
Yeah. Right.
Do you see differences there? Do you find that you counsel men and women differently, or they have different challenges in this
If
area?
I do differentiate across the sexes, that is my unconscious bias. It's possible I do that. It's not my intent. My intention is to be very egalitarian and to give the same information, ask the same of anybody of any gender. But it's also possible that that's my blind spot. I would have to get feedback on that.
And what if you have, I mean, do you find that women might complain more often of attempts to make communication more assertive or direct in how that's received? Have you heard any differences there in your patient population?
Interestingly, it doesn't come to mind offhand.
Hmm.
I am aware of the fact that here's where I see a gender difference, and this may be very congruent with your book, that women who are still raised in society as being caregivers and biologically more caregiving will put the other person's needs more higher up on the hierarchy, and that might then influence how they try to negotiate boundaries and things of that sort. So, in that respect, I think maybe there's a gender difference in terms of how much leeway women will give other people than men will. But in terms of the actual content of the communication, um, I've heard, men and women say things that were just like very, very aggressive and harmful. And I've heard both men and women say things that were way too deferential. It might be more about which situations do they choose, and do women choose more situations in which to be deferential. But when it comes for fighting time, I think they both fight.
Certainly true. I would not disagree with you there. I'm wondering about, I mean, I do write about something called hyper accountability, an
Mm-hmm.
expectation that women may face, and certainly men as well, especially men in caregiving professions like healthcare, therapy, therapists. This idea that I can control someone else's emotional experience or thoughts. And I think sometimes in our communication, our goal is that I change the way that person's feeling, and therefore I
Yeah,
fail if I don't. And I'm wondering how
right.
you would speak to that.
Boy, that's another great one. Part of being empathic is wanting to help someone feel better. We can't make someone feel better on demand. We can't say to someone, stop being so angry.
Hmm.
Stop your crying. You shouldn't be upset. You've got nothing to be anxious about. We can't do that. That's invalidating, by the way, anyway.
Yeah.
Um, but what we can do is contribute some care and have the mindset that that contribution does make an impact over time. But the other person might need to have their emotions. They might need to cry it out. They might need to have their tantrum, whatever. You can still make your point with the idea that, okay, we had a dialogue here, such as it was. Later on, we'll see if this made an impact. And this happens in therapy a lot, where a therapist makes a comment that seems to have no impact, And then the next session, the patient says, I was thinking about what you said and blah, blah, blah. I'm thinking, really? You thought it didn't appear that you were listening, but I guess you were. And then over time, with experience as a therapist, you realize you don't have to see the change immediately. You start the process going. So similarly in your personal life, you can let the other person have their emotions, but still care and understand and communicate that and have a pretty good idea that that's going to make an impact at some point.
Cory, I could talk to you all day about this. I love hearing your perspective on it. I guess I need to not keep you here all day. I know you have
Sure
things to
thing.
do. I
Yeah,
guess my final question is sort of
yeah,
this broad sense of, hearing what you're describing, thinking about our communication style. How can we as individuals practice these things? What are some really key areas you want us to take away
yeah.
from the conversation?
The thing about first seek to understand. Make that an important goal to really get what the other person's trying to say and communicate that you want to understand what they're saying, even if it's a conflict. Um, Communicating your intent, coming right out and saying, I'm not trying to give you a hard time right now. I really am not. I just want to help you understand where I'm coming from. And if you disagree, I respect you for that. It's like, spell out the intentionality. And also things like be willing to say positive things when they come to mind. Don't just keep positive things to yourself. If you have compliments to give the compliments. If you have terms of endearment you want to say, don't be embarrassed. Give the terms of endearment. And one of my favorite little quips is talk a lot of positive stuff behind people's back. You know, say positive things about people behind their back. It'll get back to them, believe me. But be positive more often. Don't just think, oh, it's kind of sappy, whatever. Speak your mind positively. And there's many more, but that's kind of a summary.
I love that. That's a good reminder. I'm going to try that today. And I'm going to say
Yeah.
directly to you that I think you're fantastic and you're doing such important work and are a wonderful teacher. I love that you came on and talked to me. I'm probably going to beg you to come back on in the future.
Jennifer, the admiration is mutual. Thank you for having me on. And I greatly appreciate our musical ventures as well. For those of you listening, you may not know that Jennifer is a jazz singer, and I have at times accompanied her on keyboard, and it's a pleasure to do so.
Oh, your piano skills are really stunning whenever you come over to play. Our
Yeah,
boys get so excited.
yeah.
So, well, this was
Thank you
such a
so
pleasure,
much.
Cory. Thank you for
You bet.
everything.
You bet. Okay. Bye bye.